What can you do about wrist pain in downward facing dog pose? For the answer, stay tuned. Many students notice pain in their wrists when they practice downward facing dog and other poses like handstands and plank pose, in which weight is put on the hand with the wrist cocked back. That position can cause pain in the wrist, and the student wondered what she could do about this pain. Now, first of all, let's say this is a very common condition, particularly among practitioners of vigorous vinyasa or flowing styles of yoga, in which people may do repeated sun salutations, sometimes a dozen or more sun salutations, which include chaturanga dandasana, which is like a yogic push-up with the hands cocked back, and dog pose, etc., that can strain the wrist. And this can be a problem that gets worse and worse over time and even cause symptoms outside of yoga class. Now, I think a major reason this happens has to do with the way people put weight on the hands. Specifically, people are putting almost all of their weight right on the wrist part of the palm and not enough weight on the knuckle part of the hand. Okay? And so there's a way you need to learn how to balance the actions of the hands into the mat. Notice my hands as I prepare for downward facing dog. You can see that almost all the weight is coming back toward the wrist and very little is coming onto the front knuckles. That's not a good formula. You can also notice that there's subtle supination of the hand, where the outer part of the hand is weighted more heavily than the thumb and index finger side. So we're going to try to even those out. And you can see that if I were to come into dog pose from this position, that all the weight is falling here on the wrist. And what I'm going to try to do is have more weight come toward the front knuckles, pronate more as I lift up. And what I'm really trying to do is open these two rows of carpal bones so that they separate, so that the bottom row continues to push into the floor, the distal row, and the proximal row of carpal bones moves up toward the elbows. Now, there's another consideration, and that is that the carpal tunnel, the space in the middle of the 8 wrist bones, through which a bunch of tendons and also the median nerve pass. Now, if you look at your wrist, you may notice that there's a slight groove there, or ideally there is a groove there, which is the indentation of the carpal tunnel. Now, many people, when they cock their wrist back, they lose that indentation. All the contents of the carpal tunnel end up get pushed forward toward the edge of the wrist. And then when they lean into their wrist in dog pose or other poses, they end up getting discomfort, maybe numbness and tingling in the hands or pain in the arms or other symptoms. Now, there's a way you can learn, again, by putting weight more on the knuckles, by kind of tenting and causing a dome in the palm and kind of lifting up from the forearms to raise the carpal bones toward the elbow. So there are 2 rows of carpal bones, 4 bones in one row, 4 bones in the next row. Now, many people think when they bend the wrist that all the movement happens between the forearm bones, primarily the radius, and the proximal row, the closer row of 4 wrist bones. But that's not the only place where bending the wrist happens. It also happens between the 2 rows of carpal bones. So it's not just all bending back in one place, but it's bending back in 2 different places. And when you get that full second bend as well, which is part of that lifting up out of the forearm, that creates more space in the wrist. So that's part of it. I'll come into dog pose now. I'm just going to do a deeply bent knee version, which I've come to prefer in recent years. So that's all the weight of the knuckles. Now I can take some of that weight off by just pushing more strongly into my legs backward. That takes some of the weight off. But let me come back down. This time I'm going to put more weight to the front knuckles, and as I come into the pose, really focus on lifting up through the forearms and to lift the proximal row of carpal bones toward the elbow, creating space in the wrist. And that is a much healthier way to do dog pose. If that's sufficient, then you may be able to continue your dog pose. But sometimes the best yoga for certain problems is to refrain from the yoga that's bothering it. And as much as you may love your sun salutations and your chaturanga dandasanas, you may want to refrain from these poses for a while to give your body a chance to heal. Okay, all for now. Thanks much. Namaste.